I am Ramona and welcome to Ramona Interviews. And with me in the chair today is Frances Anthes. She is the CEO and president of the Family Health Center of Worcester, which is growing phenomenally. Welcome.
Thank you so much, Ramona. It's a pleasure to be here.
Thank you. Tell us about the Family Health Center of Worcester.
Well, Family Health Center was started as a storefront community health center back in the 1972. So literally we were a storefront in Main South on Main Street and grew kind of incrementally over a number of years. When Worcester City Hospital closed back in 1991, we were the local healthcare provider. So we went up to the old Worcester City Hospital and occupied for many years 3 floors of that building, providing medical care, providing dental care, providing mental health, social services, behavioral health, and lab and pharmacy and radiology. We were really lucky, though, in the last year or so to have grown quite a bit at our 26 Queen Street campus. So we've increased our primary care for more access for people who want to have a doctor or want to have a nurse practitioner as their provider. And we're also about to finish up increasing our dental with more dentists. And we have increased pharmacy, which has been very crowded. And soon we will be opening up eye care in a partnership with Mass College of Pharmacy and Health Sciences. You can come to Family Health, you can get your eyes examined, and you can get your glasses.
That's exciting.
It's very exciting. It's been a busy year, but a very exciting year.
Yeah. Where would you like to see it go in the future? And then tell us about the event that's coming up.
Well, Family Health is set up on the principle that everybody has a right to health care, and cost or insurance or lack of insurance should not be a barrier. So we want to offer all the services that people need in as much as possible in one location. We recognize that many of our patients may have issues with transportation or may have language barriers, and so we can provide many of those services in one location in a way that's easily accessible. But we also know that the need to grow that continues as the patient population comes to Worcester. We have more people in Worcester than we did 10 years ago, and more people who need health care, sometimes around specialized needs around language or transportation. So Family Health is growing, and we expect to continue that growth. For us, it was a place where we had outgrown our space, and we were able to kind of increase that space and provide more care. So I see that as being our future. But we also know that we're very lucky in Massachusetts in that Romney Care led the way for Obamacare, and many, many, many of the folks who live in Massachusetts have access to health insurance right now. But there's 2 issues with that we have to pay attention to. And one is that it's a pretty complicated system, so that even if you know that you can get health insurance, figuring it out, sometimes you need some assistance with that, and we can help people figure out what they might be eligible in terms of health insurance. And then there are some people who just are not going to be qualified. Maybe they're not qualified because they just lost their job, and part of their job included health insurance, and now they're stuck. And a health center basically says, come to us, we will take care of you regardless of your ability to pay, regardless of your insurance status. So we think that as a community health center, we're able to respond to those needs that come up for all sorts of people when they don't expect it.
Absolutely. Now, you have an event that's coming up. Tell us about the event and the location. You've been doing it for quite a long time, and your goals.
Sure. So I think that it's finally becoming springtime here in Worcester. We've had a long and cold winter, but I think that it's springtime. And for us, one of the things that spring says to us is our annual fundraiser, which we call Art in the City. And Art in the City was started about 13 years ago with the concept that we're a comprehensive health center. We believe in the idea that health involves all aspects of a person's being. And part of that is that you feel good about where you live, you feel good about your family, you feel good about the neighborhood, you feel good about the life that is yours at that point in time. And we can provide many different kinds of care that help you to feel better mentally, that help you to feel better physically, that make sure your mouth is not an issue for you. But it's more than just the physical pieces that are part of healthcare. So about 15 years ago, we began to talk about what we needed to do so that our health center reflected that idea of a total commitment to what it was to be healthy. Mm-hmm. And we said we need art on our walls. Well, as a community health center, you usually have fairly limited resources. So art wasn't just going to appear on our walls. And we decided to start this fundraiser, which we call Art in the City. It is very strongly supported by our local artists who donate work or donate a portion of their work to the health center. We have an auction. People can buy the art. It's great art. It's really a wonderful evening as well. And then we take some of the proceeds that we get from that auction and we buy new art and we put it on the walls of our health center. So over the years, we've not only been able to raise funds for our basic mission in terms of healthcare, but we've also been able to make our health center a wonderful place to come and look and see art, and the art that reflects the needs of the community and the needs of our local artists. So it's become something that we really appreciate. Some of the artists who donate have actually been those folks who have said, you know, there's times when I don't have health insurance. As an artist, it's not always easy to get health insurance. And so I really want to make sure that I donate to Family Health because you've taken care of me when I need it. And some are just people who very much appreciate that in the society in which we live, not everybody has good access to health care. And they want to support that. And then some of us, frankly, just come because it's fun. It's an interesting evening. Not only do we have works of art, but we also have a live auction which features things like, you know, the day trip on the boat in the harbor and the golfing outing or tickets to sporting events or in what has become one of our probably signature events, there's a group of artisan loaves of bread that always are very, very interesting to the people who come to our auction and get a high price in terms of resources. So it's a fun event, and it's at Mechanics Hall. It's on Friday, May 9th from 6 to 9 p.m. And we usually get a good crowd, but we're really excited about welcoming new people to join us. And I'm happy to have this opportunity, thank you, to talk about it.
Yeah. And is there a website people could look up and find out something about it?
Yes, Family Health has a website, which is our initials, fhcw.org. But we have a special website for Art in the City, and that's artinthecity, all one word, .org.
.org. And tell us the date, the day, and the time again.
We'll be looking to meet everyone who wants to come to our event on Friday, May 9th, from 6 to 9 p.m. at Mechanics Hall.
How exciting. We wish you great success with your event.
Thank you so much, Ramona.